Today I'll discuss the many herbs and supplements that can be used to help treat high blood pressure. Magnesium intake of 500 milligrams to 1,000 milligrams per day may reduce blood pressure. It can also help treat arrhythmias and help normalize the heart rhythm. Excessive magnesium consumption can cause diarrhea. Therefore, one of the most absorbable forms that's easy on the stomach and the bowels is magnesium bisglycinate. As magnesium is also required by numerous enzyme pathways in the body, it has a wide range of health benefits and should be seen as essential nutrition for everyone. Potassium is also an important mineral required by the body for regulating blood pressure. Potassium also helps to ease tension in your blood vessel walls, which further lowers blood pressure. Supplement restrictions prevent a therapeutic dose being sold in capsule form. Therefore, one of the highest food sources available for potassium is bananas. Coenzyme Q10 has been shown to improve symptoms of congestive heart failure. Coenzyme Q10 may also help reduce blood pressure. Some research also suggests that when combined with other nutrients, coenzyme Q10 may aid in recovery in people who had bypass and heart valve surgeries. Typical therapeutic doses of this are 200 to 300 milligrams per day. L-Arginine and L-Citrulline. Research has shown that oral L-Arginine can lower blood pressure in healthy people, people with mild blood pressure elevation and diabetes, and in people with a type of high blood pressure that affects the arteries in the lungs and the right side of the heart, known as pulmonary hypertension. The amino acid L-citrulline also raises the body's levels of L-Arginine. A mix that can be used is 1 teaspoon of L-Arginine with 1 teaspoon of L-citrulline. This acidic tasting mix can be sweetened with stevia in 1 glass of water, and this can be drank first thing in the morning and last thing at night, preferably on an empty stomach, as other food prevents the absorption of amino acids. According to scientists from Johns Hopkins University's School of Medicine, high doses of vitamin C, an average of 500 milligrams per day, may produce small reductions of blood pressure. Vitamin C may act as a diuretic, removing excess fluid from your body. This may help lower blood pressure within your blood vessels. A whole food source of vitamin C with bioflavonoids is more effective than plain ascorbic acid. MSM is usually combined with vitamin C. Findings indicate that MSM may protect against inflammation in the heart and thereby protect against inflammation-linked cardiovascular diseases. 5 grams of MSM may provide the required benefits. However, many people take much larger doses, such as 30 grams per day, of MSM for its other benefits, such as treating candida, removing toxins, helping to cushion your joints, improving your hair, skin and nails, etc. L-Theanine, which is extracted from green tea, may be beneficial for those who experience increased blood pressure in stressful situations. One study showed that people who usually experience high blood pressure after specific mental tasks found that L-Theanine helped reduce the increase in their blood pressure. Avena sativa, or oat straw, a common stress remedy that helps nourish the body with its high B vitamin content, also contains avena anthrides. These may help lower blood pressure by increasing the production of nitric oxide, the gas molecule that helps dilate blood vessels. Passion flower, or passiflora, is commonly mixed with Avena sativa. A study found that blood pressure levels were significantly reduced likely due to the GABA promoting properties of the flower. Passion flower also has an antioxidant enzyme that helps lower blood pressure. Taurine has been shown to lower blood pressure in several hypertensive animal models. Researchers have also shown a link between a higher taurine level and significantly lower rates of death from heart disease, as well as reduced cholesterol and blood pressure. Taurine may help reduce high blood pressure by decreasing the resistance to blood flow in your blood vessel walls. Early research suggests that taking 6 grams of taurine daily for a week reduces blood pressure in people with borderline high blood pressure. Omega-3 fatty acids are essential nutrients that are important in preventing and managing heart disease. Findings show omega-3 fatty acids may help to lower blood pressure. One study of 90 people on dialysis found that taking 3 grams of omega-3 fatty acids per day significantly decreased both systolic and diastolic blood pressure when compared to placebo. Garlic supplements have shown effectiveness in reducing blood pressure in hypertensive patients, similarly to first-line standard antihypertensive medications. Kyolic garlic, which is fermented, has also shown promise in improving cardiovascular health by reducing arterial stiffness, elevated cholesterol levels, and blood stickiness. For high blood pressure, 300 to 1,500 milligrams of garlic tablets taken in divided doses for 24 weeks was shown to be successful in a trial. Hawthorn is considered by some to be an adaptogen, meaning it can balance many areas of the body. Hawthorn is used to help protect against heart disease and help control high blood pressure and high cholesterol. Both animal and human studies suggest hawthorn increases coronary artery blood flow, improves circulation, and lowers blood pressure. A 16-week study in 79 people with type 2 diabetes and high blood pressure observed that those who took 1,200 milligrams of hawthorn extract daily had greater improvements in blood pressure compared with those in the placebo group. Animal studies have shown that capsaicin in cayenne peppers may reduce high blood pressure. One study in mice with high blood pressure showed that long-term consumption of dietary spices containing capsaicin helped reduce blood pressure. Dr. Christopher, the herbalist, would add cayenne and lobelia to all of his formulas, as he believed they had a balancing effect on the body. Researchers have found that taking celery seed extract improved blood pressure levels in patients who had mild to moderate elevations. Celery seed is sometimes used as a diuretic for conditions like gout and arthritis. The compound xanthohumanol in hops was shown to help relax blood vessels and improve blood circulation. Hops, however, are considered to be estrogenic, and some have linked the classic beer belly and enlarged breasts in heavy beer drinkers to the estrogenic effects of the hops. Grape seed extract. A review of 16 studies in 810 people with high blood pressure or an elevated risk of it found that taking 100 to 2,000 milligrams of grapeseed extract daily significantly reduced systolic and diastolic blood pressure. Pycogenol, the pine bark extract, seems to lower systolic blood pressure, but doesn't significantly lower diastolic blood pressure. There's some evidence that taking 200 milligrams of pycogenol daily might decrease leg cramps and menopausal symptoms also. Resveratrol, found in small quantities in red wine, is being investigated for its possible life-extending properties. Some research shows that resveratrol could be linked to a lower risk of inflammation and blood clotting, which may lower your risk of heart disease. A typical dose is 500 to 1000 milligrams per day. When you eat too much salt, which contains sodium, your body holds extra water to wash the salt from your body. In some people, this may cause blood pressure to rise. The added water puts stress on your heart and blood vessels. Instead of cutting out salt, however, just change to a natural salt, such as Celtic sea salt or pink Himalayan rock salt, as the micronutrients in it are needed. Researchers at Kent State University have found that mindfulness-based stress reduction meditation can reduce high blood pressure. Regular physical activity, such as 150 minutes a week, or about 30 minutes most days of the week, can also lower your blood pressure. Cardiovascular or aerobic exercises are recommended, like walking, jogging, swimming. With cholesterol, high blood pressure, hypertension, and high cholesterol are linked. When the arteries become hardened and narrowed with cholesterol, plaque and calcium, the heart has to strain much harder to pump blood through them. As a result, blood pressure becomes abnormally high. Watch out for my video on cholesterol management with herbs and supplements.